There were 5 primary rationales which highlighted the need for the Leiter-3. The first, to expand the scientific knowledge base of theory, clinical research, and assessment concerning nonverbal cognitive functioning in children, adolescents, and adults with primary disabilities in mild to moderate cognitive disorders and delay, autism spectrum disorder, and communication disorders. We wanted to expand the age range into adulthood, as there is a dearth of resources for assessing nonverbal intelligence in adulthood. The second, early identification of cognitive delays. Early intervention is paramount in preparing a child for school. Cognitive assessment devices are essential elements in evaluating children who qualify for services under the Individuals with Disabilities Education Act, or IDEA. The third, measurement of small increments of improvement in cognitive ability. There has been a critical need for a measure that provides ability estimates sensitive to small increments of improvement, rather than just a comparison to a norm-referenced group. It is informative to be able to measure the quality and magnitude of gains achieved by children during the course of development. Documenting small increments of improvement are critical for special educators and parents or guardians who care deeply about the progress of children and adolescents with disabilities. The fourth, reliable and valid intelligence measurement regardless of language or motor ability. Many of the nonverbal tests available only measure a portion of cognitive ability, or administrative directions within the measures require verbal material and motor responses. The fifth, transition planning for entering the world of work. IDEA requires transition services for adolescents. It is important for cognitive abilities to be related to an overall transitional plan, and assessments should be sensitive to growth achieved by the individual during phases of the transition. The Leiter-3 uses movable cards and blocks with pictures and manipulatives, or foam pieces, to respond to illustrations, sequences and patterns, etc. on an easy-to-use easel and block frame display. The blocks have replaced the cards from the Leiter-R and are now used with a plastic frame in which to move the blocks. Cards are still used, but only to present stimuli used with a picture easel. The clinician administers and responds using gestures, facial expressions, pantomime, and pointing. The test has been streamlined into 10 subtests, which is different from the 20 subtests in the Leiter-R. 5 of the tests make up the core cognitive battery, 1 being optional, visual patterns. 5 are supplemental for assessing attention and memory. One of the attention and memory tests is a nonverbal Stroop task, which will provide information on neuropsychological functioning. The subtests within the core cognitive battery are figure ground, form completion, classification and analogies, sequential order, and visual patterns. The subtests within the attention and memory battery are attention sustained, forward memory, attention divided, reverse memory, and nonverbal Stroop. The subtests administered within each battery vary for different age groups: 3 to 5, 6 to 10, and 11 to 75 years of age. It is important to closely follow administration instructions located in the administration guide and on the easel and stimulus book pages for age-appropriate starting points with teaching trials. However, if the individual cannot independently provide correct answers, even after teaching, the examiner should turn to the starting point for the preceding age group. Standard stop rules are based on cumulative rather than consecutive errors, and each subtest has its own stop rule. We have included an examiner's rating scale at the back of the record form to be filled out once you have completed testing. Before we demonstrate a Leiter-3 administration, it is important to note several general testing considerations. The Leiter-3 should be administered in a quiet area in a school, office, clinic, etc. External distractions should be minimized so that the individual can concentrate on the test. Ensure that the testing environment has adequate lighting so that there is no glare on the testing materials. A smaller desk is most important so that the examiner can be positioned at an angle across from the individual. However, ensure that you have enough room for your set of blocks or keep them handy on a chair beside you. The examiner should be able to observe the individual's performance on one side of the easel or stimulus book, as well as administer instructions. It is important to be very familiar with the test and all instructions in order to creatively signal and point with great affect on the teaching items to help the individual understand the task. This is especially important for the attention divided subtest. Please read the directions thoroughly on attention divided and practice several times before attempting to administer. A gesture laminate is included with each kit in order to help with and standardize the gesture pantomime process. Thumbnails of gestures used on each task are included in the record form, as well as on stimulus pages. Subtests should be administered in order according to the administration guide, unless a variation in the order would facilitate the individual's performance on the test. For example, if an individual refuses to participate on a certain subtest or loses interest after starting, you may choose to move forward to a subtest that is more interactive and uses manipulatives. You can then return to the subtest that presented difficulties. Every reasonable effort should be made to complete a subtest when started. However, if an individual refuses to cooperate, proceed and then return later. All changes in order of administration should be noted on the examiner's rating scale. The majority of subtests are untimed. Timed subtests are specified with a picture of a watch next to the item on the record form and in the administration guide. It is valuable to use a rotating motion with both index fingers pointing toward one another to indicate speed up. See gesture laminate for a more detailed example. These nonverbal cues also pertain to the pacing rule. The pacing rule states that examiners should look for clear evidence from verbal or nonverbal behaviors that indicate that the individual is 1. Hopelessly stymied, 2. Making guesses at items that are far too difficult, 3. Totally distracted from the task, or 4. Extremely frustrated with their inability to solve the item. Each response on the Leiter-3 is scored. In other words, partial completion of a sequence is credited for most subtests.